Okay, hi George, Dr. Buford. I'm here with Mixing Rest Shoulder Team. We're just getting started on the left shoulder, looking at it from the back to the front. Everything's magnified 30 or 40 times, and this is that injury to the biceps tendon. And we can see how beat up this is as we look down and see if we can get a shot. So the cartilage, yeah, so we can see fissuring in the cartilage down below. And I don't think this is something I would want to do a slap repair on. I think we better start doing a biceps tenodesis for you. So that was the thing we talked about in the office. So we're going to go ahead and cut the biceps here. Okay, now you see the biceps is out of the way. And now we'll take the shaver and we will smooth out this remaining labrum that's torn. I examined your shoulder before we started. You didn't have any instability, so I'm a little surprised to see the tearing extend around this far anterior. So we will just braid it down. Okay, come to the center. Okay, so that looks a little better. It's a little bit on the humeral head here. We can smooth that out a little bit. We'll look up at the rotator cuff. The rotator cuff looks just perfect. I'm going to take the camera and have a look towards the back of the shoulder. This posterior capsule looks good. This anterior. Make sure we've smoothed out everything. We need to. Again, we examined your shoulder under anesthesia and there was no instability, so I'm not going to do anything in the way of an instability type surgery. We just have this labral tear to deal with, and it looks like we're going to be fine just debriding it. Okay, so we're going to keep working inside the shoulder. If there's anything else really important to show you, we'll come back up on the video. But otherwise, the next thing we'll show you will be our look in the subacromial space, possibly. Okay, George, we're up in the subacromial space. This gives us a view of the top or superior surface of the rotator cuff, which looks normal. It looks great, no tears. I'm just taking away some of the bursal tissue with the shaver. We took away a little bit of a bone spur, and I'll show you what the finished result looks like. Right here, this is the undersurface of the bone. You can see the fresh edge, and now it's nice and flat. My shaver here is flat, so when I lay it underneath, I can see how there's nothing hanging down that can pinch on the rotator cuff anymore. So we're going to finish up here, and we're going to go ahead and get that biceps repaired, and then we're going to get you back to the recovery room. Because the biceps repair is no longer arthroscopic, this will be the end of the video. So relatively short video, just because the rest of what we have to do, which takes us about 20 minutes, is not arthroscopic. So I really hope this does the trick for you. Good luck to you now. Bye-bye.